You just heard that person's amazing story about surviving that stroke and the impacts afterwards. So we're going to continue the conversation about strokes and what we all need to know to save a life, maybe your life, maybe a loved one's life. We have Dr. Rodriguez, an interventional radiologist in the Triad. She's a member of the Cone Health medical and dental staff as well. All right, so Dr. Rodriguez, let's start by talking about who is at risk for strokes, because I think a lot of people think it is simply older adults.
Yeah, hi, good evening, everyone. Yes, stroke is certainly more common in older adults, but it's not an exclusive disease of older adults. It can happen at any age, including babies, all the way to, adulthood and in our senior years.
Okay, so there are health conditions that people should be aware of that may increase the risk of having a stroke. What are those health conditions?
Most importantly, high blood pressure, diabetes, and previous cardiac disease, such as heart failure, atrial fibrillation. But there are many things that can be associated, increase the risk of strokes, such as sleep apnea, having a previous stroke, increase your chance of having another stroke, and in general, unhealthy lifestyle choices. Like too much alcohol, certain illegal drugs can increase your risk of stroke. So there are many things that can affect your risk of having a stroke.
All right, and so for people who say, I have a family history of stroke, I'm at an increased risk, is there something that can be done for those of us who have stroke that runs in our family?
Absolutely. Like genetic factors, your race, your age, you can change, but there are many things that you can control, and many things you can do to prevent a stroke. Like, for example, you can control your blood pressure, control your diabetes, choose healthy food to consume, low sodium, fruits and veggies. Physical activity, for example, is another important thing, and try to get a good night of sleep is also very, very important. So it's very important to follow up recommendations from your primary care physician that will guide you how you can improve your chances of avoiding having a stroke.
Okay. All right. So what we're going to do is we're going to continue this conversation after the break. We're going to talk about the warning signs and what to do if you think someone is having a stroke. It could save a life of someone that you know and that you love. We'll be back in just a minute.